tonight. There's growing concern among educationists about the sudden rise in the number of girls who return to school pregnant after the 10-month COVID-19 school shutdown. In a recent report released by the Ghana Education Service, more than 109,000 girls were found to have taken seed during the period, with nearly 3,000 of them between the ages of 10 and 14. More than 107,000 were also between the ages of 15 and 19. In the Upper West region, 694 girls ended up pregnant.
Now, and I want to go back to school again. So they said that will help me to go to the school, and I thank them once again. And I want to tell my people they should take care of themselves, keep themselves well. And as I am going to the school the first time, I was in a Form 2 and I got the pregnant. So my parents didn't have money to take care of me, and I got pregnant with one man. So I didn't go to school again. So life again came to help me.
4 months pregnant before I was in the school, but when I got 5 months pregnant, then I left the school. So I came back and I sit at home. Now it's 8 months now. I left school. So the boy that I had him gets pregnant, he told me that he's not the one. So finally my father accepted, and he's helping me to buy everything that I will need for the hospital and the baby's things and everything that we need for the pregnancy now. So by now, as the boy she did not accept it, we are continuing and we are trying our best to convince him, but not like he wasn't even my boyfriend. He forced me, and that was my first time too. So we try our best, but she did not accept it. So by now I'm staying in my father's house, and he's taking good care of me. Everything that I need, he will give it to me. So by now, God willing, next month maybe either I can deliver or not, by the grace of God.
So those are some girls speaking to our Upper West correspondent, Rafiq Salam. These are girls who are being helped to go back to school. But I want to give you a breakdown of the figures from the 2020 data that we have. And we're sourcing this from the Ghana Health Services District Health Information Management System. And if you're looking at figures between the ages between 10 and 14 years, you have 2,865 pregnancies. And remember, this is just the year 2020. Okay, when you go to the ages between 15 and 19, you're looking at 107,023 girls getting pregnant just within the 10-month period where schools were shut down. And those are data again from the Ghana Health Service. But we want to look at the regional breakdown for you. And of course, you're seeing right there the Ashanti region leading the chart with 17,802 cases recorded. Remember, 2020. The Eastern region, we have 10,865. The Central region comes close with 10,301. And this is quite interesting because previously we've seen the Central region leading in cases of teenage pregnancy. And so there seems to be a drop, however significantly huge the figure is. In the Northern region, you have 9,249. The Greater Accra, 9,018. The Western region comes up next with 8,533. The Upper East follows 6,533. The Volta region, 6,144. The Bono East, 5,741. When it comes to the Bono region, you have 4,478. Then the OT region comes up next with 3,970. Following closely is the Northeast region with 3,780. And of course, the Western North region also coming up with just a 30-point difference with 3,700 3,550. And then we have the Upper West region, 3,583. The Savannah region, 3,516. And of course, the Ahafo region, which is bottom on this chart, 2,625. And so these are the figures for the year 2020, the 10-month period within which schools were shut down. And these are figures, data from the Ghana Health Service. Let's do some more on this story. We're joined by the founder and president of Challenging Heights, James Kofi Annan. Thank you very much for your time here on Joy News Prime. Let's also speak to the Northern Sector Programs Manager for Plan International, Eric Ayaba. Gentlemen, I'm grateful for your time. Let me start with you, Mr. Annan. Your own backyard, you look at the figure and you have over 10,000 girls in the central region alone getting pregnant within 10 months. Your reaction to this?
Well, thank you, and good evening to your viewers and listeners. I think these figures are very worrying, and it's an indication of some of the challenges that women, especially girls, face all the time in the midst of crisis. And it also speaks of the inequities in our system when some segments of our society become so vulnerable during crisis period. But there are a number of issues that needs to be addressed here. One, we have to look at the issue from the perspective of the law. I am not a lawyer, but at least I work with the law. And I know that if a girl becomes pregnant, who is between the ages of 10 and 14, straight away that's defilement under the law. And defilement needs to be dealt with by the DOFSU of the police service, so that the perpetrators of that crime would be held accountable. We need to make those people accountable for what they have done to these girls. So that's the law. Also, these children have rights, and the right to education is a right that is enshrined in the Constitution. So we cannot say because a girl got pregnant, if she wants, and I listened to your interview and I realized that one of them was very emphatic that she wants to go back to school. Yeah. But it appears that she's being denied the opportunity to go back to school. The fact that she has become pregnant does not mean that her right has been taken away from her. So I believe that the system, which is Ghana Education Service, the DOFSU, Ministry of Gender and Children's Protection Unit, they must all come together to ensure that the girl gets the education that she needs. Now,
before you proceed on that, some of the girls we spoke to are actually girls that are being helped by the Ghana Education Service to get back to school. Of course, they had challenges, which were, challenges they experienced even before the GES came in, which are challenges I would want Eric Ayaba to raise for me because he has worked in the northern sector. Mr. Ayaba, you have worked in the 5 regions of the north as far as these issues are concerned. Out of that huge number, just a little below 100 are going back to school. That is certainly worrying.
Yes, thank you very much, and good evening to your listeners and viewers. Indeed, it is a worrying situation. Seriously worrying that at this stage where these girls should have been in school, should have been learning to ensure that their lives become better in the future, they end up getting pregnant. They end up carrying babies that they were not prepared for. They're carrying babies that sometimes they don't even know who really gave it to them. These are worrying situations. And as an organization, Plan International, working through the northern sector, we have come across this. The challenges can be multifaceted. Poverty has always been the issue that a lot of people bring up the moment you ask about why this thing happened. Because of poverty, sometimes families are not able to cater for these girls and they have to fend for themselves. Sometimes peer pressure. Sometimes just their inability, their lack of knowledge or inadequate knowledge on sexual and reproductive health issues is a big, big, big issue. Some of them don't even know, or they don't understand how one even gets pregnant. Girls of about 12, 13, 14, up to the teen or 18 may not sometimes surprisingly even understand how they get pregnant. It tells you clearly that the knowledge of these girls are just too below the level. So these are all some of the reasons that we have encountered. And we think that to solve this problem, we must work as a team, collectively, government agencies, civil society agencies, local organizations, and more importantly, bringing the girls themselves into the picture. We have to move away from the situation where we think that we can do everything for the girl child or adolescent child. We have to involve them, listen to them, hear them, and help them acquire the knowledge that they can use to be able to prevent or protect themselves from this particular situation.
And that also speaks to the cultural challenges of some of these issues that we are faced with, especially in that part of the country where you have worked. But let me come to you, Mr. Annan. You mentioned that immediately the law must work so that perpetrators will be held to book. You're calling for the Education Ministry and, of course, the Gender Ministry to help these girls get back to school. But remember that these incidents were recorded during the 10-month shutdown of schools. Does this then raise, questions about the educational system and perhaps the need to introduce some more reforms to respond to some of these challenges?
Well, I believe that you are aware that the educational system is already undergoing some reforms. That makes room to address some of the inequalities within the educational system, which is in a good direction, I would say. But our school system is such that it doesn't necessarily give room for girls to have confidence in themselves and in the school system to protect them. And when girls don't have faith in the protection mechanism when they go to school, then they see outside the school environment to be a bit more comfortable than the school environment. And I agree with Plan that we need to bring these girls into the picture. But bringing the girls into the picture, you are talking about a girl who goes to school and there's no toilet in the school. How does the girl goes to the school and even change her pad if such a girl has had menses? This is a bottleneck that needs to be addressed because the school environment does not make it safe. The cultural nuances of corporal punishment, of men hegemony in society also makes it very difficult for girls to say no, or even for girls to report some of these abuses to higher hierarchies because they fear that if they should report, they could be branded as being bad girls, or they could even be punished for so doing. So yes, I agree. We need to bring these girls into the picture. But we also need to tackle the social and cultural situations and inequities that drives girls into the corner, making them feel powerless and unable to speak up for themselves. And as we go along, I think that in reforming the educational system, we must go along with addressing some of these challenges. It is not only about the quality of learning, teaching and learning we are thinking about, but we must also think about the quality of life of these children in school. So that they feel that they have an environment that is conducive and safe for them to learn.
Mr. Annan, I'm grateful for your time. That's the president of Challenging Heights. And just in 30 seconds, Mr. Yaba, what can we expect from Plan Ghana going forward? Because you indicated that civil society must get on board, partner government to address this. In 30 seconds, what can we expect from Plan Ghana?
Yes, what we can expect from Plan Ghana working together with its partners is to enhance the knowledge on sexual reproductive health. Like I said at the beginning, knowledge is very key. How do we enhance the knowledge of these girls to be able to protect themselves?
Okay.
Girls should be working through groups, in adolescent groups. Ghana Health Service, together with its partners, must work towards ensuring that the adolescent health corners are well equipped and have very knowledgeable and well-prepared counselors to help these girls.
Great.
Then we should also be using even innovative method. In our case, we have what we call music for change. People learn through music, people are entertained through music, people are informed through music. Some of these girls can come together working with their youth counterparts to create local music that really demonstrates the importance of the girl and the consequences of allowing these girls to get pregnant at the beginning.
I want to thank you.
Serious, innovative ways that will be able to address this challenge within the shortest possible time.
Thank you very much. That's Eric Ayaba. He's the Northern Regional Manager for Plan Ghana International.